Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 News Conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, March 10th. I'll turn things over to Dr. Fitzgerald to give us an update on today's numbers.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. I'm very pleased to report that since the media advisory yesterday, we have no new confirmed cases of COVID-19 in our province. The total number of cases is now 1,010. There have been 6 new recoveries in Eastern Health, leaving 74 active cases in the province. There are 3 people in hospital due to COVID-19, and a total of 118,103 people have been tested to date. In assessing our readiness to relax measures, we examine a number of indicators to determine if the epidemic is controlled. We monitor trends in new cases, hospitalizations, and deaths. And thankfully, we have been consistently trending in the right direction in recent weeks. It is important to assess whether the exposure source of our cases is known. Cases with no identifiable epidemiological link, or non-epi-linked cases, cause the most concern as they represent undetected community transmission. We do not have an indication at this time of undetected community transmission. Testing volumes and percent positivity are additional indicators to assess against these other measures, and these are also trending in the right direction. The capacity of the public health system to respond is also important prior to the relaxation of measures. For example, we want to see a high proportion of test results reported within 48 hours of swab collection, and likewise, we want to see that most cases are reached within 24 hours of being reported by the laboratory. Our public health system is able to conduct rapid contact tracing at this time. We are pleased with the outcome of the voluntary asymptomatic testing conducted by Eastern Health. Over 3,000 volunteers agreed to participate in the asymptomatic surveillance. This involved our partner organizations in the downtown metro area, as well as rural communities throughout Eastern Health, including Burin, Clarenville, Bonavista, Placentia, and Trepassey. No positives have been detected to date. Based on this response, Eastern Health will be closing the intake process for additional volunteers as of the end of the day today, and anticipate concluding asymptomatic testing sites by Friday. Home visits for asymptomatic surveillance testing has also concluded. However, anyone with symptoms referred for testing who are unable to leave their home to travel to drive through the test clinic can contact 811 to have alternative arrangements made. Based on all these factors, we feel confident that we can further ease restrictions on Friday. So effective 12:01 a.m. March 13th, the Avalon region will move to alert level 4, and areas outside the Avalon will move to alert level 3. We must be mindful that while our provincial epidemiology is in a very good place, the same cannot be said for outside the province. We therefore remain at risk of importation of the virus and the variants of concern that are now in greater circulation. We saw firsthand how rapidly the B117 variant spread in our province, and that's why we must ease restrictions slowly. We will closely monitor the epidemiology as we open to ensure that there is no increased transmission. We have adjusted restrictions in each level, recognizing that COVID variants and worldwide epidemiology put us in a very different place than we were when these levels were developed last summer. And while travel within the province is not prohibited, we do ask that you limit travel as much as possible. We recognize that there are activities that are beneficial for mental health, such as going to your cabin or snowmobiling, and if you do choose to travel for leisure, go directly to your destination and be prepared with your supplies to avoid having to enter public places along the way. In level 3, each household will be able to have a maximum of 10 close, consistent contacts. This is not 10 contacts per person, it is 10 for the entire household. Try to remember the phrase, your tight 10. Close, consistent contacts are the individuals who you interact with socially in close proximity for an extended period of time on a regular basis. Just as we recommended at Christmas, determining who your close contacts are is a conscious and deliberate decision that each household must make. And if you are a parent with a teenager or a young adult in your home, they need to be a part of this conversation. Outside of your tight 10, your school-aged child should only be interacting with your close class cohort at this time. Your tight 10 does not include the school cohorts, co-workers, healthcare providers, coaches, or personal service providers. We expect that people will keep these interactions to a minimum and use distancing and masking to reduce the risk of COVID transmission. Your household's tight 10 also does not include brief interactions in retail establishments, for example. But keeping our contacts low is one of the most important ways that everyone can help prevent the spread of this virus. And as we saw in the last outbreak, public health capacity can quickly become overwhelmed when each family has a significant number of close contacts. The risk is a delay in tracing and isolating close contacts who could potentially be infected and unknowingly contribute to the onward spread of the virus. In level 3, social gatherings outside of your tight 10 are not permitted. Informal gatherings such as religious and cultural ceremonies and services, weddings, funerals, and burials are limited to 20 people, provided physical distancing can be maintained. We will monitor this over the next 2 weeks and determine if we are able to safely increase the maximum. Anyone attending a formal gathering should wear their mask for the entire time, even when seated, and should only be removed when seated to eat and drink. Funeral home visitations are permitted, but limited to one household at a time. In Level 3, restaurants are permitted to operate for in-person dining at 50% capacity, provided they can maintain 6 feet between patrons seated at tables. This does not mean 6 feet between tables. It is the distance between people that matters. Restaurants need to be strict in enforcing this. Bars, lounges, and cinemas remain closed. As St. Patrick's Day approaches, it will be particularly important for restaurants to adhere to these requirements. Eating and drinking should only occur while seated, and anyone not seated must wear their mask, and there should be no movement of individuals between tables. For retail establishments in Level 3, occupancy is dependent on how many people can fit with physical distancing. Recreational spaces such as gyms, fitness facilities, dance studios, arenas, and pools can open in Level 3 with restrictions. There can be no more than 20 individuals in a facility, and only if space permits to allow distancing. Only individual or household activities and lessons are permitted with limitations. No team sports or group classes are permitted at this time. Masks should be worn at all times, even during mild to moderate physical activity. We are also making changes and recommendations that apply to the entire province at this time with regard to long-term care and personal care homes and assisted living facilities. Now that we are 2 weeks out from all residents of long-term care, personal care homes, and assisted living facilities from being offered their first dose of the COVID vaccine, we are relaxing visitor restrictions to allow 2 designated visitors for each resident. This is in addition to any essential caregivers that were identified previously. We will reassess this in 2 weeks to determine if we can expand the number of visitors. We are asking businesses to have employees work from home wherever possible, regardless of alert level. This recommendation will be in place until we have a sufficient proportion of the population vaccinated. The key to keeping everyone safe is keeping contacts as low as possible, so we need to eliminate all unnecessary contacts. As a reminder for those on the Avalon, I'll go through the restrictions for Level 4, which will be coming into place midnight Saturday, or Saturday morning. Informal social gatherings are not permitted. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to 10 people, provided physical distancing can be maintained. Public visitations and wakes remain prohibited. Outdoor playgrounds and equipment can be used. Gym and fitness facilities, yoga studios, tennis and squash facilities, arenas, dance studios, and performance spaces remain closed. Private healthcare clinics can reopen in accordance with guidelines, and retail stores, including those in shopping malls, can open at 50% capacity, provided physical distancing can be maintained. Personal service establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons, can open in accordance with guidelines. And restaurants remain closed for in-person dining. Bars, lounges, bingo halls, and cinemas remain closed. As a recap for those who may have just joined, we have no new confirmed cases since yesterday's media advisory, and the total number of cases in the province sits at 1,010. Tomorrow marks 1 year since our first COVID briefing and since the WHO declared a COVID-19 pandemic. This anniversary gives us pause to reflect on everything that has happened in the last year, both the bad and the good. We have all been impacted by this pandemic in different ways, some of us more profoundly. Loved ones have been lost and loved ones have been separated. Our strength has been tested. Despite the heartache, struggles, and disappointments, we have also seen this pandemic bring out some of the best in humanity. Dedication from healthcare workers, first responders, and frontline employees who continue to show up for us despite the risks to themselves and their families. Communities that came together to lift spirits and help those who were isolated or needed assistance, and the continued determination of everyone across our province not to let this virus break us. We have learned so much from this pandemic over the last 12 months, and we continue to learn more every day as evidence emerges. One day, this pandemic will be behind us, but we can never leave the lessons we have learned in the past. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. It's taken over 3 weeks to get this to this point. 0 cases. It's a number I know we've all been wanting and hoping to hear. In addition, the asymptomatic testing that's been underway this week has not resulted in any positive cases. This is a very good sign. And as Dr. Fitzgerald just said, on Friday, we'll be moving down a level to level 4 on the Avalon Peninsula and level 3 throughout the rest of the province. This is encouraging and good news as we are able to cautiously return to a more normal sense of life. Let's remind ourselves, though, that COVID-19 is still active in this province. We can expect to continue to have cases, but our goal must be to keep the numbers low, to be able to trace the source of each case, to keep close contacts and spread to a minimum. This is a proven strategy for effectively fighting COVID-19 while we continue to implement our vaccination protocols. Now's the time for continued caution, not for celebration or complacency. I know it's asking a lot as we've been through a lot in the last year during this health crisis, especially in the last month, as the province has been either in alert level 4 or 5. But we must keep listening to the advice of Dr. Fitzgerald and her public health team. We must keep our guard up. Of course, good news with the arrival of the first doses of AstraZeneca in our province this week. These doses will immediately find their ways into the arms of our first responders. Every day, our first responders live with a job stress that's hard to imagine for most of us. And having to worry about COVID-19 on top of their own job stress has increased that stress. So I'm relieved that this is happening. Soon enough, we hope to have everyone receive that dose of relief too. Fortunately, the days are getting a little longer. The clocks spring ahead on Saturday, and we are slowly making our way out of all of this. Use that extra daylight to head outside if you can. It's the easiest and best thing for your physical and mental health. So we are getting through this, Newfoundland and Labrador, together. I'll now turn it over to Minister Haggie for a few remarks.
Thank you very much, Premier. This is our 140th live update, and according to our figures, we have reached over 11.2 million viewers on Facebook alone since that day in March of last year. We have 0 cases for the first time in 36 days. As the Premier referenced, AstraZeneca arrived early. 50% of those doses will go to Eastern Health, and the rest are divided pro rata between Central at 1,500, Western at the same, and 500 for Labrador Grenfell. And in actual fact, the RHAs are now seeing if they can expedite the delivery of those into people's arms from Monday and perhaps even start at the weekend. Each of the RHAs is now vaccinating community-based individuals over the age of 85, so that's another step in the right direction. Our big gap around vaccination is a knowledge gap that we share with pretty well everywhere else. We do not know what this vaccine does and the immunity it provides in terms of the ability of people who have that immunity to transmit the virus to others. That is going to be a big factor in our discussions around what the options would be for level 2 and level 1 as we move ahead. The other piece, Dr. Fitzgerald has really gone through a very extensive list of changes, and from a communications point of view, Health and Community Services will be issuing more detailed news releases over the course of this week, and certainly on Friday. We will also make sure our website is updated. Realistically, that will probably be late Friday or early Saturday to provide that level of granularity. My understanding is, as far as education is concerned, they will be making their own arrangements to provide updates in a timely way for teachers and for students. We are making progress. It's a marathon with hurdles, not a sprint. And all I can do is mimic Dr. Fitzgerald's phrase of hold the line. We have done well with public health. We're doing well with vaccine. And the people of this province have done well in doing what we all needed to do to keep things under control. So with that, Premier, I'll hand it back to yourself.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, when it comes to schools and the education system, what is your recommendation for schools on the Avalon? Is it similar to what the rest of the province went through 2 weeks ago?
So my recommendation, or Public Health's recommendation to the Department of Education and to the school districts was that, the same recommendations that we made 2 weeks ago still stay in place. So that will be masks for everyone in grade 4 and above. We've had PPE requirements for teachers with regard to a level 1 mask and eye protection. And as well, when cohorting is not possible, that 2 meters of distancing be maintained between students. So those were our main recommendations with regard to schools, and those stand. Yeah.
Thank you. And looking for some clarification on bubbling or increasing household contacts for alert level 4. What is the recommendation there? I may have missed it in your preamble, sorry.
Oh, yes. No, actually, I don't think you did. I don't think I mentioned it. So what we had recommended in level 4 was that if you could connect with immediate family members when needed to provide support or care of some type. You could bring in caregivers to your home, and you could support people who were isolated, who you may know. So there's just some very small number of close contacts that really it's more necessary for either functioning of your home or to help someone else function in theirs.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, if you're confident that the situation has improved, why wait until Saturday? Why not make the change a couple days early?
So this will all depend on things staying the same between now and midnight Friday. So we said we'd have to give it 2 weeks, and that's what we wanted to do. So, barring any major changes between now and then, we expect that we will be able to do that on Friday, midnight. So,
I want to ask about sport. You mentioned at the last briefing that it's likely that we're going to have to be more restrictive with sporting activity, and that we did see some spread at sporting events in this most recent cluster. Can you give us a little more of an explanation? How many cases were acquired from sports, and what sort of sports?
Yes, so I don't have that breakdown, that detail at this time. I'm hoping to have that by the end of the week, and so we'll hopefully be able to answer that question a little more clearly at that time. It has taken Eastern Health, there were a lot of contacts, there were a lot of things to sort through, and so it has taken Eastern Health some time to really be able to work through all of that and be able to piece all the pieces of the puzzle together, really.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I'm wondering why it's still too risky for a rotational worker to go for a walk, like even wearing a mask, avoiding crowds. Are there going to be any movements towards relaxing measures for those workers again?
Yep. So I think it was Monday that I said we were working on that, and we hope to have some more information by the end of the week with regard to rotational workers. So.
Okay. Thank you. We've talked about the significant amount of protection provided by just one dose of the vaccine, but I realize that Dr. Haggie just said there's so little we know about it. Is it possible, though, that with 2 doses we will start to see some sort of restrictions lifted for such people?
For which people, sorry?
For people who have both doses.
Oh, sorry. So I think as we get more information, the problem is right now, it's so new, we just don't, and it hasn't been around a long time. We don't have a lot of experience with it with regard to, how far out can we go. And certainly the information that we have right now is that the protection levels are holding at 2 months. We don't expect it to drop off suddenly or precipitously at that, anytime between 2 and 4 months. And so we do expect that level of protection will be maintained. The issue is more that we don't know what the effects on transmission are going to be. And until we have a little bit more information about that, and I guess we won't know until we have a little bit more time and more people having had the vaccine before we can make those determinations. So it's really hard to predict what will happen. The hope, of course, as always, will be that we will be able to lift some of those restrictions as more and more people get vaccinated. But we can't really say what the effect on herd immunity is going to be, and we may have to consider that it is a protection of the herd, but not necessarily immunity of the herd. So those are two different, we need to think about this quite separately to some degree. But our hope, of course, is that we will be able to lift those restrictions.
Thank you.
Our next questions are from Richard Duggan with BOCM. Please go ahead.
Thank you. Dr. Fitzgerald, you mentioned in your opening remarks about travel and within the province and how some travel may be essential for mental health reasons, and you advise what people should do if they do choose to travel. Are we still advising against non-essential travel in and out of the metro area at this time?
So at this time, yes, this will apply as of Friday midnight. But what we're saying is that travel should not be something that you're doing frequently unless it's essential travel, like for work or for medical appointments or something like that. But that, if you are going to be traveling, if you're thinking about, going skidooing somewhere, or you're thinking about going to your cabin, really think long and hard about, the interactions you're going to have along the way, and try to reduce that as much as possible, and to really be as safe as possible, and bring your supplies with you, and if you can. And so it's really just about being thoughtful about how you do it. But we're not saying that you can't do it. We're just saying be thoughtful about how you do, and try to reduce the potential harm as much as you can.
And I was wondering if we could get an update regarding the cases at St. Clair's Hospital.
Yeah, sure. So we haven't had any further cases. It's been several days, I think. Probably, since we've had any cases related to that cluster. And the total, I believe, is 7 staff and 6 patients, and then there was some secondary spread from patients to family members. And perhaps staff to family members as well. So we haven't seen anything recently, and that's all good. We are moving out from that now, from those last cases. So we're hopeful that the worst of that is over.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Dr. Haggie, in the past you haven't wanted to commit to a deadline, sometimes adamantly. But on Monday you joined the Premier in predicting that anybody in Newfoundland who wanted to be vaccinated would be by the end of June or early July. To be fair, you inserted a caveat about supply issues, maybe throwing those dates off, but you're certainly more definitive than you've been previously. And what I'd like to ask is what's changed? You seem to have shed some of your reluctance about setting about predictions.
That's a good question. It is difficult to give guarantees. We are being informed by our federal counterparts that supply chain has stabilized, certainly with regards to Pfizer, little less so with Moderna. But we feel that between what we have been promised and the time frame that we have, that it would certainly be the situation that everybody would have had one dose of some vaccine by the end of June or shortly after Canada Day. And under those circumstances, based on what Dr. Fitzgerald's speaking about, there are possibilities then about what alert level 1 may or may not look like. Again, given the difficulties we have about the gaps in knowledge that we all have, not just unique to any one jurisdiction. So I think it's really the level of confidence expressed to me by federal counterparts about their confidence in the manufacturer's abilities to actually live up to their promises.
Well, then, to follow up, a question for you, Dr. Fury, and perhaps you, Dr. Hackett, as well. On Friday, the Premier was talking about the accelerated delivery schedule and his confidence that that was going to get us to the finish line on this. I question whether the federal government's track record isn't a reason to be more conservative in forecasting. For example, on Friday, Health Canada approved the J&J vaccine, but as recently as like yesterday, the Prime Minister is talking about manufacturing problems and not having any idea when that vaccine is going to be available. But it's been my experience that politicians want to announce good news during election campaigns. And so what I'm wondering is your optimism being colored by the pressures of being in a campaign?
No, not at all. I think that this is, we critically looked at the numbers, and the numbers are what the numbers are. We think that we'll have more vaccines than we are required, from, again, echoing Minister Haggie's comments, based on an increase of supply and a more robust supply chain. So I think it's important that people know that. I think it's important that people see the light at the end of the tunnel. And as I've said before, this is about public health and safety, not about re-election.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, question for the Premier. Three other Atlantic Canadian premiers are having a meeting next week to discuss reestablishing the Atlantic bubble, the maritime bubble, I guess. We've reported very few cases this week, 0 today. Why isn't Newfoundland and Labrador at the table for those discussions?
Well, hopefully we will be if the cases continue to stay down. There's still 74 active cases in the province today. That's still, triple what we see in Halifax, I think, in Nova Scotia, if I'm remembering correctly. So, hopefully our numbers go down and we can be reintroduced to the Atlantic bubble. But as we've said before, that depends on numbers here and numbers in the other Atlantic provinces. So I'm hopeful that we can get there. It's just a matter of when.
What do you say to people who argue, and I guess this is for Dr. Fitzgerald, what do you say to people who argue that, all of these cases that are still active cases are in isolation? We are moving down one level at a time, and at this pace, it is gradual, but, you might even say it's glacial, especially given all of the active cases are in isolation, 0 new cases announced today. Is it just as well that we move to level 2, given given the situation?
So, I don't know, I've never seen glaciers move, but I think it's significantly slower than what we're doing. I think one of the lessons that we have learned, not just ourselves, but from our friends across the country as well as across the world, really, is that a slow reopening is the way we have to do things. And, I think at this point, looking at where we are and taking a 2-week interval when we know that the incubation period of this virus is 2 weeks, when we know it can take up to 2 weeks for people who may have had the disease and get sick enough to end up in hospital, to make sure that, we're making good decisions when we move from one level to the next, as we increase our movement, as we increase our interactions and movements within society. I think having that 2-week window to see what's happening is actually is a good thing. And I think as public health, it behooves us to really make sure that we're doing things as carefully and thoughtfully as we can. We've been in some conversations where there's been talk of extending that interval even to 3 weeks, but at this point we feel that 2 weeks, given where we are, is certainly appropriate, and so that's why we're looking at a 2-week interval in between.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, is it a firm 2 weeks, or is this something that may potentially be reassessed in a week, and based on the epidemiology at the time or the evidence at the time, we could see a shift to alert levels faster?
At this point, Kellyanne, it's a firm 2 weeks. It's the incubation period of the virus. Back last summer, we went 2 incubation periods. We went 28 days. And we know now that probably we didn't need to wait that long. We didn't know it at the time, but, we're learning as we go. And so we do feel that the 2 weeks is the minimum that we can wait in between levels to make sure that, we're where we want to be before we open up that little bit further.
Thank you. And a question on vaccine rollout. We know in Eastern Health Region that the over 85 group is now being notified for vaccination appointments. What's the determination on who gets the call for when, knowing that it wasn't a first come, first served basis? I'm just getting a lot of questions from some people saying, I'm 93 and I haven't gotten a call, but my 86-year-old neighbor has gotten a call. Just needing some clarification around who gets called first.
So I'm not sure of all the details of, who gets called in the in one particular area, but I know that they are setting up clinics in different areas. So depending on when those clinics are, of course, will determine when people get called. But with regard to, if there's someone has to be first, someone has to be second, someone has to be 40th, right? So it's just, I don't think there's any really big formula for everybody who's over the age of 85. I think it's just as they can get to people, they're getting to people. So, but certainly, it may be a better question directed at the regional health authorities. I certainly don't want to speak out of turn.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
A question for the Premier. The head of hospitality in Newfoundland and Labrador is warning that there needs to be travel and tourists from outside of the province in order to make a summer season viable, that they need not just an Atlantic bubble, but they need Canada-wide this summer in order to prevent many of them from going out of business. How much will that factor into decisions that are made about opening up this summer?
Of course, all those things will be taken into consideration, but the primary concern is following public health and safety guidelines and following Dr. Fitzgerald's recommendation based on the epidemiology of the jurisdictions involved. Of course, we're all very cognizant of the economic fallout and the business issues that exist for individuals and businesses, and we want to be supportive of them. But first and foremost is public health and the epidemiology. And subsequent to that, then we weigh all of those considerations in the decision matrix about whether to proceed with the Atlantic bubble and then indeed the rest of the integration to Canada proper.
And a question about the logistics of getting your second shot. Now that we're delaying the doses for 3 months, what's available for people who may end up, for example, they may be going to school in St. John's and then 3 months later they'll be somewhere else in the province, or someone who may move into the province after receiving 1 dose and needs their second dose. What's in place in order to facilitate the mobility of people down?
So all vaccines are going to be recorded in our EMR and our other health systems that we have, and our health record, electronic health record. So we will be able to access and find out who had what dose where, and so that won't matter from within the province. And certainly that is something that will be that can be accommodated. With regard to people coming from outside the province who may have had a vaccine somewhere else, certainly that may require a little bit more work, and the public health in that area may have to get confirmation from another area just to make sure of the type of vaccine that was had. Although my understanding is that most places are giving a little card or something to indicate which vaccine that people had. So I certainly would recommend, if they get anything like that, that they do hang on to it so that that information is, they have that information with them. But this happens all the time with many vaccines, right? Like there are lots of people who come here outside of COVID who have to finish vaccine series here in this province, started them in another province and have to finish them here. So there's already a communication line that it answers those questions for us across the country.
Okay, thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Yes, I'm wondering whether there's been any further movement towards surveillance testing of sewage.
Sorry, surveillance testing of what, Peter? Apologies.
Sewage, Premier.
Wastewater.
Yeah, I could add.
Wastewater. Sorry.
Oh, okay.
Yeah, okay.
So we have done some testing, very early stages, very preliminary results, and at this point, we certainly have seen that we have seen signals that were I guess, aligned with our epidemiology at this time. It's sometimes difficult here with regard to wastewater because it very much depends on the flow through the system, and unfortunately with our climate we have a lot of freeze thaws, we have a lot of runoff sometimes, we get rain as well as melting snow this time of year, and if the flow is really high, unfortunately we can't do the testing or it interferes with the testing. So it can be difficult. We're still sort of, it's new to us. We're still working through how we're going to use that information going forward. But we're hopeful that we're going to be able to employ it as a surveillance tool going forward.
Okay, thank you. This is a bit of a broader question. I'm not sure who wants to answer it. But assuming numbers do go down this year, borders start reopening, birds start flying again, what elements of our new normal do you think will persist in terms of public health? Is there something that's going to be a hang around from this experience?
Well, hopefully everybody washes their hands more.
Hopefully. Although we kind of forget about that as time goes on. I don't know. I mean, I think there are a lot. It's a good question, Peter, because, I think we all sort of sit down and think about this one, but it can be difficult to really answer that because so much might depend on exactly what's happening in the world. If we feel like we got a good handle on most things, but there might be some variants of concern that don't respond to certain vaccines or things like that, then there may be things that we have to hang on to that are a little bit different than what we would expect at this time, But certainly I think physical distancing is something that we need to be thinking about on a regular basis. Masks will probably be something that persists into, fairly far into the future. It does seem to reduce risks. And to be honest with you, I know we were doing a lot of physical distancing and stuff during our flu season, but seeing what has happened, not just with flu, but with other respiratory viruses that we usually get this time of year, the number of outbreaks we've seen in long-term care because of mask wearing and things like that, I think all of us are sitting down and have a little rethink about how we approach things with regard to masks. So there's lots of learnings we're going to take away from this, and I think some of those public health measures are going to stick around for a while, but and some of them we may bring back from time to time, just for old time's sake.
Okay, thank you.
We've definitely learned a lot, though, that we can adapt for future outbreaks
absolutely.
or future viruses, or H1N2 or whatever is going to come next.
No, not H1N2.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Daycares in alert level 4 outside the Avalon, when we made that move a few weeks ago, could open to full capacity when we made that switch. As we move into level 4 on the Avalon, Dr. Fitzgerald, what's your recommendation for how daycare should operate? Do you think full capacity would be safe in this region at this time?
So we've certainly made our recommendations to the Department of Education with respect to daycares, and we recognize that as more people are going back to work, obviously childcare has to be something that's available to them. So we've put lots of measures in place. Once again, we've put in, made recommendations about PPE and distancing and, cohorting and all of that, which have really been in place all along. With those recommendations at this point, we feel that daycares can safely continue to operate at capacity.
Okay, And the PC party has sent out a release saying that with the move in alert levels and the drop in cases, they're urging for us to take a look at in-person voting again. Dr. Fitzgerald, from a public health perspective, do you think that would be safe at this time?
Yeah, I don't think it's appropriate for me to talk about the election at this point. You know, we made our recommendations back when we made them, and I think, you know, Elections NL had to pivot and do what they can. So I don't think it would be appropriate for me to really comment at this time.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Well, I was going to ask you about the PC press release. You already answered it. Thank you very much. Dr. Fitzgerald, I want to pay you a compliment and ask you a question. On the weekend, on Sunday, I booked a test, and my wife and I booked a test. Only a few minutes after we hit send on the online application, we got a phone call giving us a time for 1:15. So a couple hours later, we picked up Tim Hortons and Torbay Road and drove to the Reed Center. Got in a line. There were 3 vehicles in front of us, one each at one of the 3 stations. We pulled into a line as the car was pulling out. We got swabbed, and we were done, and our coffee was still warm. So I don't know if that was had things. Were you expecting more people, and was it scaled up for more people, and the numbers are just lower, and it was just really easy for everybody? Because I was in a longer lineup yesterday at Robin Hood Bay Dump than I was on Sunday.
That was my experience as well, Roger.
Yeah, I think certainly they were prepared for you know, as many people as wanted to be tested, and we really had no idea how many people were going to want to avail of that testing, and so I think they scaled up to some degree to prepare for that. They didn't, you know, they didn't want people to be waiting for a long time in line. But I mean, on the whole, we're quite pleased with the number of people that have come forward, and you know, we have gotten a bit of a snapshot for what's happening in this area. So, but I think, you know, they've got it down now. They just know how to do it. They're phenomenal, and they've really worked hard to be able to have things move smoothly. So, which I think bodes very well for us going forward.
Well, it was pretty slick. A second question: the AstraZeneca vaccine. As I understand, there's 7,000 doses arriving, or some of it has arrived. I'm not sure if it's all arrived, but it has an expiry date of April the 2nd. So I guess that's like going into the Dominion store and picking up a salmon steak with one of the 50% off stickers on it that says "Enjoy tonight." But is like April the 2nd it? If those things aren't used by then, is it tossed?
I mean, certainly we generally don't use vaccines past their expiration date, I guess. You know, it's not that it would be harmful, it's just that we're not sure of what the immune response would be at that time. Certainly we have plans right now. Not all of the vaccine has that expiry date. Some of it is later. So we have plans to use that first, and we have plans to use, I think, all of it before the expiry date.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Dr. Fitzgerald, you alluded to this earlier, but I wonder if you could just go into more detail for us. You said there's certain aspects of levels 3 and 4 that are stricter than before. I wonder if you could take us through some of the elements that have been tightened up and just talk about why those changes have been made, why they're important.
So I think actually there's just differences. We sort of looked at where our risks are, and we know that our risks are in groups. So when we see people getting together in larger groups, so that's why we're making some of those. Those are where the differences lie. So Previously, we allowed, I think it was, I'm not 100% sure now. That's so long ago. But, you know, we allowed, for example, we did allow aesthetics in level 3 before, but, you know, we've allowed in level 4 for some things to open, but that we didn't allow in level 4 before they were allowed to open in level 3. So, you know, we've made some changes. So some things have moved up, some things have moved down, but where the biggest changes actually happen are in gathering sizes and how we approach gatherings, really. And so we're looking at trying to do contacts and personal contacts as you know, as people sort of live their lives in the way that people live their lives, and that's why we're saying that there's 10 contacts outside of your household. We've certainly gone much slower with regard to gatherings and how quickly, you know, we move up that scale. So we really are more cautious about our gatherings at this point, and we've really tried to limit them as much as possible. You know, those formal gatherings for religious and cultural ceremonies and services, and taking that a little more slowly. So that's where the main differences lie, and just a reevaluation of how we approach some team sports and things like that. So we're really trying to take the evidence that we have gathered both here and through this most recent outbreak, the information we know about variants and the way that they spread, because this has really changed the way we have to look at things, and then the information that we've learned from elsewhere in the country and around the world to inform our opening process, or reopening process.
And my second question is for Mr. Fury. I understand that you're looking to take a very sort of prudent approach to reestablishing the Atlantic bubble, if that's where we end up going. But I'm curious, is there because this is so important to the tourism sector in particular, is there contingency planning happening for a scenario where we weren't able to reopen in terms of supporting those businesses that rely on travelers coming into the province?
Well, I mean, first of all, we're certainly hopeful that won't happen. But to your point, in terms of contingencies, the Tourism Task Force is set to give us recommendations next week. Certainly, they'll all be taken into consideration. But we recognize the value that the tourism industry has for the province. I think anyone does. And it's important to ensure that they're well positioned to emerge from this pandemic in the right way, when the right way occurs. But again, we're very hopeful that this summer will be a productive one for the tourism and hospitality industry within the province.
Thank you.
I'll now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, mine's in regards to cohorts within schools, and just knowing that we're looking to limit our contact as much as possible. If there's been a change in the recommendations around cohorting for schools, if we're looking at a big difference between alert level 4 and alert level 3 now.
No, so cohorting is still the same. Our recommendations are still, you know, exactly how those cohorts are carried out, of course, that's an operational thing, but our recommendation regarding cohorts, generally speaking, is that it's a class of students. You know, what we have to remember is that, yes, we are trying to keep our contacts as low as possible, but we also have to remember that it's important for children to be in school. And so we are trying now, with all of these measures that we've put in place, and with limiting our contacts as much as we can outside of school, to what we're trying to do with all of that is to keep our communities as safe as possible. Schools are a reflection of what's happening in the community, generally speaking. So, you know, we need to keep our communities as safe as we can, so that we can keep our schools safe. And that's what we're trying to do with all of this direction, is so that we can keep the kids in school where they need to be.
Thank you.
Peter Cowan with CBC. Do you have a final question?
I do. For folks in the Metro St. John's area that are now moving to level 4, question about outside activities. People who may, for example, want to be able to see friends, but because they're not considered essential, should they be getting together outside where they can physically distance, for example, if they want to see people that are outside of their household?
So we do know that being outside is safer than being inside. And I think, if people want to go, I'm just thinking, if you want to go outdoors and go sliding and, you're sort of doing things side by side. But what you need to remember is that in a lot of cases like that, kids, if you're going as two families, the kids in those families are likely not going to be able to stay apart from each other because they're going to be so excited to see each other. So you do need to remember that. So as much as possible, we would encourage people here on the Avalon right now to continue to do things as a household. That includes indoor and outdoor activities.
Thanks.
Peter Jackson with The Telegram. Do you have a final question?
Just a quick question. I'm wondering whether any of you had conversations with your provincial and federal counterparts about the possibility of vaccine passports.
A vaccine passport, was that the question?
Yes.
Certainly the last conversations that I had were very preliminary, and there was no definitive movement one way or the other. I know that there was talks of it and but as Dr. Fitzgerald has said, people are provided with documentation of vaccines all the time. So in terms of a formalized passport, I'm not aware that there's been any further formal movement on it. I know the federal Minister of Health was musing a little bit about it, but I have no insight into, I'm not sure if your counterparts, Minister or Dr. Fitzgerald, have had any, no?
No, it's not something we've discussed to any great degree at all. We're, with regard to that, you have to worry about inequities that can get established very quickly when you're thinking about people who've had vaccine versus not. So we certainly haven't really had any in-depth conversations about that.
Thank you.
Richard Duggan with VOCM. Do you have a final question?
I do. We've heard from some long-term care home operators that say not all workers inside their facilities qualify for the vaccine, and they're looking for some clarification. They've given us samples as workers such as management and maintenance workers who they were told won't be getting it at this time. Can you explain why some workers inside these homes would qualify but others don't, given that there can be contact with patients?
So our recommendation in the face of limited amount of vaccine and wanting to get as many, all of these facilities vaccinated as quickly as we could, what we recommended is that anyone who was involved in direct resident care should be vaccinated. Those that were not, and there are some within these homes, and we do appreciate that any may come into contact of what we do have personal protective equipment that's everybody has to wear when they're in a home. Everybody has to wear a mask at all times. So we do know that there's that reduces the risk, and so it's really our focus was on those staff members that were providing direct resident care and coming into direct resident contact on a regular basis. All the employees will get done. It's just in a context of limited vaccine supply, we needed to get those most urgently done, right?
Thank you.
Roger Bill with the Shoreline News. Do you have a final question?
Yes, I have one. A reader of the Shoreline asked me about this scenario. If there's a Newfoundland resident working at a work site in Alberta and is diagnosed as COVID positive and then is expelled from the work site and decides to kind of somehow figures a way to slip through the screening of Air Canada and returns to Newfoundland. Is there a sharing of information between companies and the provincial government about non-residents, in other words, a Newfoundlander in Alberta? And then is there any communication between health departments, province to province, so you know that there's a Newfoundland resident on the mainland who's been diagnosed, and so there's an alert at the airport? Is there any way to check on that scenario?
Okay, so there's a lot to unpack there. So there is
a complicated question. I'm sorry, but it wasn't mine.
So there is a process in place. So we have, there have been Newfoundland residents who've been diagnosed away, working in Alberta, Ontario, whatever the case. So they get diagnosed away. Most of them actually stayed in the province that they were in when they were diagnosed. In fact, I think all of them did, because they weren't allowed to travel. So most of them were on strict isolation, and so they would have stayed there and been recovered, I guess, in that province. To our knowledge, everybody that has been diagnosed away and recovered away has stayed away. So we haven't had that situation that you described. Once we have a Newfoundland resident who's diagnosed elsewhere, we do get notification of that diagnosis. And then if, for example, we had someone, not a Newfoundlander, who got diagnosed elsewhere, but they had Newfoundland contacts, excuse me, then we would get notified about those contacts as well so that we could follow up. So there are very good processes in place already. That was there long before COVID, to be able to make sure that that level of communication happens.
Thank you.
Excuse me.
Patrick Butler with Radio Canada. Do you have a final question?
I do. One for Minister Haggie. We're only reporting vaccination numbers once weekly. Why not report numbers more regularly so people have a more accurate picture of the progress? And just noting that Nova Scotia does it daily, so does Ontario, Quebec, Manitoba, Saskatchewan, Alberta. PEI, I believe, does it twice weekly. Why the different approach here?
Part of our challenge is that we are a little akin to a territory, and a lot of our more rural records are initially started out as paper-based and have to be transcribed into COVID Tracker, which is the app that we use on the back end to report those. So it's consistency, really. I've spoken before about fluctuations from day to day between those administered and those delivered. We're trying to do it in a way that's A, consistent, and B, as honest and accurate as we could make it. I think you could almost pick any regimen, and it would have errors and omissions and flaws. So I think, given the need for openness and transparency, this is a compromise between that and the workload for public health to actually be doing this on a more frequent basis. So it's like all of these things, something of a compromise. But if you have a better suggestion that's more operational, that will fit our needs and fit our resources, happy to discuss it.
I just asked the question. Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you, everybody, for joining. Today is another good day as we emerge from level 5 in the metro region, level 4 in the rest of the province. But equally, we need to ensure that we're following the rules, that we're following Dr. Fitzgerald's advice, and please use this opportunity to refresh your memories about the different levels and what you can and can't do in the different levels applicable for where you live. So with that, I'll just wish everybody a happy Wednesday, and this is a good day for Newfoundland and Labrador as we continue our path to recovery.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.